Assalamu alaikum everyone, I am Dr. Uzma Khan from team Medi videos, and today we are starting with our first lecture series that's about ECG. So today is the first lecture about ECG. In this ECG videos I am going to discuss you about ECG paper, about the waves on ECG, various intervals and their significance of course, and then what are the abnormalities that are being seen in the ECG. So this is the prime target. Now to start first I'm going to discuss about the ECG paper. So this is the standard ECG paper. It has got small box, it has got large box. Okay, now this small box actually signify a duration and an amplitude. Amplitude is actually the height and this is actually the duration. So when we count this box in horizontal direction on x-axis, it actually shows the duration of 40 milliseconds or 0.04 second. But when 5 small boxes join, they make one large box. 1, 2, 3, 4 and 5. So 5 small boxes is equal to one large box, and one large box shows the duration of 0.2 seconds or 200 milliseconds. This standard ECG paper is calibrated in the machine at 25 millimeter per second speed. When the standard ECG paper at a standard speed is run through the ECG machine, so we have got the P wave, the QRS complex which is being formed by Q wave, R wave and then S wave, and where the QRS complex ends, it is shown in ECG at J point, then the T wave and then again P wave and then QRS complex. This is how it goes on. This is an abnormal wave, not always seen. I'll be discussing it in ECG abnormalities, so just skip it for a while. Now the intervals. So the duration of from the start of P wave to the start of QRS complex, it is called as PR interval. Then the ST interval, it actually starts from the J point and from the ending of T wave. So this is ST interval. Then from the ending of T wave to the start of P wave, this is TP interval. Now about the ST segment. ST segment is actually here, from the ending of QRS complex to the start of T wave. This is actually ST segment. And then the most important, which is QT interval. It is actually from the start of Q wave to the ending of T wave. Why I discussed about the amplitude and the duration? These intervals, waves, they have got certain fixed amplitude and the duration. When it doesn't come in normal range, it is abnormal, and that is being indicated in certain cardiac conditions. Okay, I missed the RR interval from between the two R waves. It is actually being used to calculate the heart rate and to standardize certain other things. So now we are first going to discuss about P wave, which is the first wave on ECG. I am just removing this screen so that we can make a good P wave. This is the isoelectric line and this is P wave, and of course after that there will be Q, R and S complex. This P wave, of course behind this is the standard ECG paper, 5 small box and large boxes. Okay, so P wave the standard duration for P wave. First we are going to discuss what's the duration. So P wave is actually the upright in all the leads, monophasic. Okay, that's called as monophasic, except in V1 where it's biphasic. Biphasic means some part of P wave is above the isoelectric line and some part is down. Okay, now I have to clean my board. Now the P wave. Okay, what is the normal duration of P wave? It is less than 3 small squares. One small box was equal to 40 milliseconds. Okay, you guys remember? Now 3 small boxes means less than 120 milliseconds. This is the normal duration. So 1 small box, 2 small box, and this is the third one. This should be the normal duration. It can be smaller than that, but when it's longer than that, it is abnormal. Okay, this is abnormal. The height, the amplitude, I told you about the duration. Here is the duration. Now the amplitude, okay, which was on y-axis. One small box was equal to 1 millimeter. So five small boxes, it means one large box was equal to 5 millimeter. Okay, now what is the normal amplitude? Normal amplitude is different in limb leads and precordial leads. As I am discussing about limb leads and precordial leads, I want you to know about the limb leads and the precordial leads. Okay, so limb leads are actually 1, limb lead 2, 3, then AVR, AVL and AVF. These 6 are limb leads. Okay, now what are the precordial leads or chest leads? These are V1 to V6. So V1, V2, V3, V4, V5 and V6. When I'll be discussing about the coronary artery territories, then I'll be discussing which chest leads and limb leads actually signify what area of the heart is being supplied by that specific artery. So the STT changes which are being shown in specific limb territories, they actually signify a wall of heart that is being infarcted or is ischemic. So actually the 6 chest leads and 6 limb leads, the total of 12 leads. So again, I think we were discussing about the amplitude of P wave. Okay, this is the P wave. So the amplitude in limb leads, which was 1, limb 2, limb 3, AVR, AVL and AVF. Okay, the amplitude in these limb leads should be less than 2.5 mm. Okay, 2.5 mm. It should be less than that. 2.5 mm means 2.5 small box. This was about limb leads. The duration was actually 3 small boxes, but now the amplitude, it should be less than 2.5 small box in limb leads and less than 1.5 mm or less than 1.5 small box in precordial leads. I think we should have a recall. What was the duration of one small box? Yes, 0.04 seconds or 40 milliseconds. Good. What was the duration of one large box? 0.2 seconds or 200 milliseconds. Okay. Now about P wave. We actually discussed about the duration, the normal duration and normal amplitude. Normal duration was less than 3 small boxes, or we can say less than 120 milliseconds. Now the amplitude, it was actually different in limb leads and precordial leads. In limb leads, the duration of P wave was, yes, less than 2.5 mm or 2.5 small box. In precordial lead, it was less than 1.5 mm. Okay. So after P wave, here comes the QRS complex. QRS complex starts with the Q wave and it ends with S wave. As with P wave, there is the amplitude on y-axis and duration on x-axis. So for each wave, like for Q wave, for R wave and for S wave, we have to look for amplitude and duration each, because there is a certain duration that's abnormal and the whole duration of QRS complex. So the normal duration of QRS complex should be less than 100 or 110 milliseconds. So it is almost 2.5 small boxes. So it should be less than that. We should say it is 70 to 100 millisecond, which is the normal QRS duration. So this is the normal QRS duration, and then the duration of Q wave, duration of R wave and the duration of S wave, and then the amplitude of each. So the amplitude of Q wave, the amplitude of R wave and the amplitude of S wave. This is important and I'll be discussing it in later lectures. If the QRS complex is narrower than this 100 millisecond, we call it as narrow complex, and if it is more than 2.5 small boxes, we call it as broad complex. It is very important because we classify arrhythmias according to narrow complex tachycardia or broad complex tachycardia. So it is the basic classification. So the duration of QRS complex is so important. Now, talking about T wave. Actually, T wave is formed after the ending of S wave. So after QRS complex in ECG, we see a T wave. T wave is upright in all leads except AVR and V1. You remember, in AVR, P wave was also upside down. It was inverted in AVR. T wave is inverted in AVR and V1. So if you guys see an inverted T wave in AVR and V1, it's not abnormal, it's normal actually. Now the amplitude. Amplitude of T wave is important. When we talk about T wave, it's actually the amplitude, because we say flat T wave or like hyperacute or tall T wave. So what is the normal amplitude? Normal amplitude is also different in limb leads and chest leads, like we discussed in P wave. So the normal amplitude in limb leads is less than 5 mm, and in chest leads it is less than 10 mm. Quite easy to remember. Okay, so in limb leads the amplitude is less than 5 mm, normal amplitude, and in chest leads it is less than 10 mm. Like 10 small boxes or 2 large boxes, or 1 large box or 5 small boxes. The duration is actually related to QT interval. It is important, but it's not the sole duration of T wave that's important. It's actually from the start of Q wave till the ending of T wave, and we calculate it, and long QT is actually predisposing to ventricular tachycardia, so it is important, and we'll be discussing it in when we'll be discussing the other intervals. So P wave, QRS complex, and T wave. These are the waves on ECG. In next lecture, we'll be discussing about the intervals and segments, and of course their significance. After that, we'll be covering each abnormality one by one, that how to look for left ventricular hypertrophy, how to look for right ventricular hypertrophy, okay, how to look for bundle branch blocks, LBB, RBB, like that. But before all that, our next lecture after the intervals and segments, it will be about approach to ECG. That will be very important, so stay tuned. Please subscribe to this channel so you will be aware of the upcoming videos. Thank you.